Scientists are working fast and furiously to find a vaccine to treat the coronavirus. As the world patiently waits, some doctors are starting to prescribe off-label drugs that might treat symptoms, but there is a major heart risk that could take your life. Our Eliza Powell spoke with some experts today at Mayo Clinic who recently published an article on how to best monitor your heart if taking these other drugs.
Though there are no FDA-approved drugs to prevent the coronavirus, some doctors are using antimalarials and antibiotics to treat symptoms of COVID-19. But a new study from Mayo Clinic wants to help healthcare providers safely use these medications to minimize the risk of cardiac arrest and death. Remdesivir and hydroxychloroquine used with azithromycin are currently being tested in clinical trials. Doctors say there are promising therapies to stop the growth of COVID-19, but a major risk factor in 1% of patients could cost their life.
This unwanted side effect, which just so happens to be drug-induced sudden cardiac death.
Dr. Michael Ackerman, a genetic cardiologist at Mayo Clinic, helped write a new article about the heart health risk and how to monitor it in patients who might take these off-label medications through something called their QTC.
That tells us what is the health of the heart's electrical recharging system.
If taking an antimalarial or antibiotic for COVID-19, your QTC needs to be monitored to determine how successful treatment could be. When the QTC is too high for too long, it indicates the patient is more susceptible to cardiac death.
The heart could electrically spin out of control into a dangerously fast rhythm.
But your QTC can be monitored easily through an electrocardiogram. There's even an FDA-approved phone app to measure it.
There's a healthy range of QTC values, and that's roughly 360 to 460 milliseconds.
Dr. Ackerman says the study will hopefully help doctors know from the start their patient's safety margin for the drugs to be therapeutic before it becomes deadly. Antimalarials and antibiotics used to treat COVID-19 should only be used under doctor supervision and instruction. And Dr. Ackerman says that if these off-label treatments for COVID-19, which are still in clinical testing, do prove effective, that it could help 90% of COVID-19 patients, but it's that 1% of those that are at risk for cardiac death that really need to monitor that QTC. In Jacksonville, Eliza Powell, First Coast News, on your side.